Joining me live now, Professor Ian Sanne from the Wits University Faculty of Health Sciences and a member of the Minister of Health's Advisory Committee. A very good evening to you, Prof. Thanks indeed for your time. So look, what we know now, the Minister of Health basically told Parliament today that the Johnson & Johnson vaccine doses, number one, are non-refundable, and that the Johnson & Johnson basically says it won't sign off those 20 million doses until there's a letter from trade and industry endorsing their investment in Aspen. How does South Africa sign this, yet we're still battling with efficacy issues? How does South Africa gamble?
So as a Sisonke team member, I can't really comment on the procurement strategy of the Department of Health and Treasury. I do hope they will resolve that very quickly because the demand for vaccine is very high, and the benefits to preventing a very severe disease and unfortunately commonly fatal disease is critical. So under the Sisonke Phase 3B study program, we did temporarily pause the study yesterday to evaluate the FDA's review of the 6 cases of rare clotting disorder that did occur in the United States. We have very rapidly met with SAPRA last night. Because Sisonke is designed as a Phase 3B study, we actually have all the data on adverse events in South Africa. We have not been able to identify a case of central venous thrombosis with low platelets or disseminated intravascular coagulation as at this time. We are meeting with SAPRA after this interview again to propose an amendment to the protocol that informs participants of these events that have occurred in the United States and in Europe. So it's a total of 10 cases, but with over 10 million doses of vaccine administered. So at a rate of somewhere between 1 and 1.4 per million. So we will be informing all of our participants of these events, and will be hopefully in a position to submit documentation to our review committees tomorrow, the ethics committees, and have the study back open on to the end of this week.
I want to talk about what this means for our rollout strategy, but even though South Africa does not yet have a case, are you monitoring, though, the healthcare workers who've already taken the Johnson & Johnson vaccine? And I guess, how does this bode for public confidence? There is quite some concern.
Yes. So we have a safety desk that requests for data to be submitted on any adverse event, mild, moderate, or severe. We have 3 pathways. Either the person can self-report, they can call the call center who will collect the data on their behalf, or the doctors can submit adverse event forms through the same data system. So we have accumulated on 289,000 plus people. We have accumulated 30,000 such reports. Most of them are mild and vaccine reactogenicity. But there are cases that are in stringent review, and we do report monthly and now 2 weekly. So we've gone to 2 weekly reporting to SAPRA in a lot of detail. So our program of safety reporting has been lauded by a number of European and US countries. We have a very good system in place and an ability to provide confidence to everyone that, in fact, the J&J vaccine is working, that the case rates of COVID amongst healthcare workers has declined by as much as 90%, and that we really do recommend to through the Minister's Advisory Committee to go ahead with the national rollout.
But what does this stop and go, basically, if I can, mean for South Africa's rollout? From what I also gathered, not that I want you to comment on it, you've already said you cannot, but what does this mean for the rollout itself? Because the Minister himself in Parliament today saying that he was quite surprised by some of now the requirements that have come through from Johnson & Johnson. What does this mean for South Africa's rollout plan?
So I think those are technical requirements in the procurement strategy with the support, with the government support for the investment in Aspen. That is my reading. I think everybody can read that in the press. And I do believe that we do need to make that commitment. We need to produce this vaccine closer to home and, in fact, to cover not just South Africa, but our neighbors. And indeed, but I think in terms of timing of the rollout, this pause that we did for research technical reasons and to inform participants of these events should not interfere at all with the timeline of the rollout.
The new variant, which had been detected here in South Africa, Prof, had also been detected in central London. It had not been previously in that specific part. Doesn't this put us in a precarious situation? Because I'm talking about, we're still battling with efficacy issues at this particular point. South Africa, of course, having to temporarily suspend J&J. How does this bode, I think, for what we're trying to do and as we're trying to figure our way around in terms of the efficacy of these vaccines?
So the viral evolution is well known. I think everyone now speaks about variants, and the label South African variant comes because it was first identified in South Africa, but there's a UK variant, there's a Brazilian variant. All of these are progressions, viral evolutions of this virus. We do know that the South African variant has led to more transmission. We don't suspect that it has led to worse disease. Yeah. And the rates of disease, it was just the second wave overwhelmed us in sheer numbers. We do know that the J&J vaccine that is being used in the Sisonke program reduces the incidence of COVID in the ensemble study by 57%. Yeah. More importantly, the reduction of hospitalization and severe disease by 85%. And on the studies, there were no deaths either related to COVID disease nor due to the vaccine. So this is a safe and very effective vaccine. The rollout has been incredible. The uptake amongst healthcare workers has been remarkable. We have been able to dispense whatever vaccine we've brought into the country within 4 days of bringing it in. This week, we're bringing in 200,000 doses more to complete the commitment that J&J provided to South Africa to vaccinate 500,000 healthcare workers. Together with the other sponsors, the MRC, University of Cape Town, and others. And so, in fact, working together with the Department of Health has been a complete pleasure. We have bedded down the EVDS systems, the registration systems, the vaccine on-site systems. We get outstanding data. Right. We have integrated our data with the NICD COVID testing data and the DATCOV hospitalization data. So all of this is working incredibly well, and in my view, bodes very well for the rollout of vaccines in South Africa.
Prof, will certainly be monitoring the situation and what further South Africa will have to say. We hope to hear from you after that meeting as well, perhaps on what the way forward will be, of course, communicated by the Health Department. Professor Ian Sanne from the Wits University Faculty of Health Sciences and also a member of the Minister of Health Advisory Committee, of course, talking a bit about the revelations made by the Minister of Health in Parliament today.